good start. So I'm going to move around the sideline. Yep. And again, just to reiterate, you really pull them up and sideline, not too far forward or too far back. But see, you have a nice line from that extended leg all through her torso, through the neck, and to the arm. So you want to get a nice stretch, yeah? Nice stretch. Holding on to the arm. We're going to come in place, stabilize this down, so this foot here like we did before, and just compressing. So you're right over so that you can extend nice and clear with your extended arm like we've been doing. You can really feel the give in the temporalis. And sutures, the heads, the bones of the head, they move right around the sutures. So you keep some nice sustained compression, you can feel that release. Then we're coming back now. Just a little review. So just to speak to that question, mastoid process right behind the ear, and then just come towards the midline and below the ridge, fine ridge, as I'm depressing the shoulder. Working that whole ridge. And then from there I'm just going to come right into petrissage of the neck. And like we mentioned, we want to be behind the SCM. So not only can you get the muscles of the neck pretty nice here from the shoulder to the head, but also you can feel for the transverse processes of the cervical vertebra, attachments of levator and scalenes and things, so it's quite nice to do that. Taking it right down to the top of the shoulder, and right in the highest point of the shoulder you feel usually some exquisite tightness here. So one of the many ways of addressing it is thumb pads over thumb pads and just doing some nice, rather firm, digital, circular friction. And then this is where we ended, correct? Where we intertwine our fingers and then with our body weight leaning back, giving them a nice stretch, right? So then this is where we pick up, where after this stretch, our fingers separate, cupping the front and back of the shoulder, and we're just going to do some nice full range of motion. First one way, and the other. And you notice my body into it a little bit, you know. So you increase the momentum, it deepens the connection. And then we're going to do a stretch, pec, major and minor. So we're going to bring the arm up and then forward. Okay, so that's muy importante. So here, so you go up and then forward, and then you're going to stretch the arm so that you get a nice direct line of stretch of the attachment of pec minor, particularly on the coracoid process. So you get a nice stretch. Feel? And this leg, inside leg, is supporting the torso, so it acts as a fulcrum, so the body just sort of folds in front of it. And then when you do stretch, easy back, you know. Easy back. And we're going to bring the arm over the hand and switch our position to this. So we're going to introduce some openness here in the side of the torso. One of the things that keeps the shoulder girdle in less than a fuller range of motion is when the serratus anterior adheres to the ribs. Serratus anterior has attachment right at the distal angle of the scapula. So nice compression here helps free the shoulder. So I use that as a mark to push against, and my other forearm is just below the iliac crest right in the upper fibers of gluteus medius, because there's a little groove there where my elbow fits in, and I fit here, and then I can just lean forward and they get a nice stretch in their side. Okay, then we're just going to turn. Now I'm facing the feet. No, follow it so that you can see. And now I'm going to just introduce compression into the side of the torso. The gallbladder meridian, which we're basically dealing with, starts here. So all this compression here, all this work on shoulder girdle, and now compression into the side of the torso is for gallbladder meridian. So again, the premise is continued time and time again. I'm working from a nice balanced stance, in a stance where I can more readily shift my body weight forward and back. That's why I choose to work on one knee and one foot long. I'm leaning in on the exhale and just letting my body weight lean in as opposed to push. Now as you continue the yang descent of gallbladder, you're going to come to the floating ribs, 11 and 12 here. So, and just below the floating ribs and just above the hip bone, the iliac crest, there's soft tissue. So the meridian continues to go through here. And also the way the torso works, you know, there's a lot of forward and backward flexion, there's rotation. So the muscles in this space help open up the lower back and support the hip. So you want to address that soft tissue. And one of the ways we do it is by what's called dragon's mouth, which is the overlay of your hands in this position. And take an inhale, please. And then on the exhale, you just lean in, and it goes right into that soft tissue. And I'm leaning in on exhale, and I'm right over the work, so. And if you want to do a little bit more in there, you could use your thumbs, right? And you can just sink in. This is a real nice way to address QL, multifidus, lateral border of longissimus, the most pronounced of the erector spinae. So it's really nice way of opening up the lower back. And you can also come in this position and use your thumbs to go right into the top of the iliac crest to get the attachment of obliques. And that continues to open up the lower back and support smoother movement of the hip. So I'm just using my thumb pads and leaning into the iliac crest. Put the arm down. Shall we stop or shall we do a little bit more?
More.
Más?
Sí,
Okay.
quiero más.
Okay, so now we've come like this, yes? We find ourselves here. So we want to continually place ourselves in a position of optimal contact. So meaning try to keep our belly, our hara, over the area we're working on. So in this case, we're going to be working on the hip. So a suggested position is taking one knee and always supporting the knee, the sacrum, and you want to come over, and the leg is coming out of the hip at a right angle. That's really nice. But if I apply pressure here, sometimes the knee starts scooting out. So if you lend support with your foot here, it sort of locks this area in, and it places you, right over the hip. So we're going to compress into the soft tissue area of the hip. And this area of soft tissue is defined by bony landmarks. You'll feel greater trochanter of the femur, and also the lateral border of the sacrum. And all of this soft tissue is just distal or below the iliac crest on the side. So the boundary here creates this crescent moon shaped soft tissue. So we're going to address that with a couple of different things. First, we're going to do a palmar compression. So use the palm, just sort of lean in. Leaning in on my exhale. So I'm using this shape of my hand, which replicates the shape here. Just leaning in. I'm going to come in with a little bit more specific thumb pad, sinking in, making it a little bit more specific. Leaning in on exhale. After you loosen up the more superficial gluteal muscles, you're starting to adjust lateral rotators, which have a strong effect on how your hip opens and your foot turns. So it's very effective for that. And then finally, we're going to use a little bit of our forearm because it fits so nicely with everything. Just leaning into that soft tissue. And then continue palmar compression right into the side of the leg. So this is a nice way to address iliotibial band, but in our focus we're following this meridian, this gallbladder meridian, which comes all the way down the side, through the hips, through the iliotibial band, outside of the leg and into the foot. So we're just adding this nice sense of compression to help loosen the musculature around the meridian. So we loosen the muscle around the meridian so that the energy can flow more readily. Help the banks of the river so the water flows a little bit more directed, a little bit more functionally, a little bit easier. So we're going to continue palmar compression down into the leg. So for those of you at home studying the anatomy, these would be peroneals, so the peroneal muscle group, the lower lateral compartment of the leg. Down, down, following yang. And it brings us to a source point. So the gallbladder meridian is coming and it goes out the fourth toe, but feel this on yourselves. Yeah, please do. The source point is, so here's your outside ankle, lateral malleolus. Feel on yourself, right in front and right at the bottom, you'll see a little indentation. And press in there and see if the person you're working on feels dull ache. Yes?
Yeah.
Y'all feel that? If not, get someone to stimulate your subo. Okay? That's source point. So we talked about source point and how it affects the overall balance of the energy. So when you stimulate source point, you want to hold it for a couple of full breaths. And then the meridian continues right into the dorsal surface of the foot and right out the fourth toe. Okay? So we include the source point. Now, I'd be amiss if when a person is in sideline position, because of how nice this extended bottom leg is, that I wouldn't dress the inside of the leg. Because it's nice and open. So even in table work, you could use this sideline position because it gives you such a nice supported position to work the adductors. Much more easier than supine. So we're gonna, but our focus today is the meridians that pass through the leg. So the meridians that pass through the leg in this position start on the foot, and they go up. So we're going to start with our compression at the foot. Okay. So I'm compressing, vaguely remembering that the quiz I just took, there was a meridian that started on the foot and it went upside the inner leg, and that was called what? You remember? Its partner? Spleen. Remember, it started on the toenail there. But it also, we talked about the source point at the base of the big toe. So when you start learning source points, okay?
Yeah, it's ticklish.
Ticklish? You want to address source point as much as you can. So you put them in there when you remember. Try to get that stimulation in there. And then today we're just going to do some general compression. So when you compress, you want to look at addressing soft tissue. So you want to try to keep the work in front of you as much as possible. And try not to work in rotation. You know, you don't want to come at it from the side and do like this, because your breath and your energy has to transfer from a ring position, and it puts up too much resistance. If you open your body, your breath comes easier. You can more readily lean your body weight in. It's a lot cleaner. And since it's cleaner and easier for you, it transfers to better contact to the person you're working on. But also it heightens your sense of palpation. You can feel more readily what's going on when you come from a more supported position. So we continue compressing, compressing, stand-upping, walking over this way, stand-upping, walking over this way, because I want to show you a couple things for the adductors, and then we'll end with a stretch. So I'm compressing at very light pressure, if any, very light pressure into the side of the knee, and very light pressure just immediately above the knee because of the attachments of the adductors. It can be very sensitive here, so nice and easy. But as you venture more up into the belly of the adductors, you can generally apply a little bit more pressure. And you can also start using different contacts. So palm is one, arch of the foot another, knee is another, bottom is another. So in a Thai massage, they call this a blood stop.
A blood stop?
Blood stop, yes. It doesn't really stop the blood, but it slows it down. So when you slow down something that's normally going at a certain rate, there's a back pressure, so it'll build up. This is you. And then so when you release the pressure, all that backup goes more forcefully through the channel, and the thinking is that it cleanses the channel. It helps remove any obstacle in the channel. So it's usually the person, after you sit here for a while, and you get up, they'll feel like a little rush. It's very comfortable, I have to say. So, you have a reluctancy to leave, but leave you must. So, come up slowly, and then we're going to end with a stretch. So sideline position gives you lots of opportunities to do lots of lovely stretches, particularly for the top leg and the torso. So I'll show you one, and then as we go on and continue to hang out with one another, I'll show you a few other things. But this one that I want you to focus on today is this. So top leg, grab at the ankle, and bring it back towards you. And then with the knee that's closest to their head, I'm going to come up and place it above their hip so it fits right in the lower back. Okay. And then I'm going to lean back with my body weight and bring their top leg back towards me. And if this leg comes up, so I can lean it right on there. And I switch hand positions. That's okay for you?
Yeah, that's fine.
Okay. So this is nice, and the more you can keep it relatively parallel to the mat, the better stretch. So you can see this is a nice stretch for psoas, but also the stomach meridian, which was also on the quiz. If you remember, yang meridian, as it was coming down, it goes right below the ASIS and just lateral of the patella. So this particular one stretches that really well. So we're going to have the person take an inhale, and an exhale, you just lean back, stretching out. And then take up the slack, basically, and then when you feel that's gone, just stop and let their body open up to that, and then ask them if they'd like a little bit more stretch.
Yeah.
Okay. So you want to inhale again, and exhale, lean back.
Yeah, it feels great.
So, and then, you know, just at one point, just hold it and let their body just open up to it. One thing that keeps the body, if there is some stiffness, then you can help loosen is to release the yang meridians of the leg. So they're all here. So this pounding a little bit, first into that portion of stomach meridian, then into the iliotibial band. And then I'm going to turn my hand, compress up into the hamstrings. And then we're just going to take one little bit more of a stretch, so inhale, and then exhale. Yeah. Now. So nice.
So great.
Very supported. Very supported. Where everything's right in front of you, coming from your center. Lovely. So again, since it's deep stretch, we're going to come out easy. Easy. And we're going to bring her back into supine. And we're going to use the leg as a lever to bring her back into supine. And straighten her out. And then that's where we would transition and do the other side. Okay. Okay, awesome. Thank you.